Effects of high-intensity exercise on blood sugar stability in people with diabetes. Diabetes is a chronic metabolic disorder characterized by high blood sugar levels, which result from the body's inability to produce or effectively use insulin. Controlling blood sugar levels is an important aspect of life for people with diabetes, and this control is influenced by a variety of factors, including diet, medications, and physical activity. Exercise is widely recognized to benefit overall health, including that of people with diabetes. Regular physical activity helps improve cardiovascular health, enhances insulin sensitivity, and helps control weight. However, the relationship between exercise and blood sugar levels in people with diabetes is complex and needs to be managed carefully. Intense physical activity, in particular, can make it difficult to maintain stable blood sugar levels, leading to potential risks such as hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. Blood sugar is the main source of energy for cells in the body. After eating, carbohydrates are broken down into glucose, which enters the bloodstream. The pancreas responds by releasing insulin, a hormone that allows glucose to enter cells, where it can be used as energy or stored for later use. For people without diabetes, this process is tightly controlled, ensuring that blood sugar levels remain within a narrow range. However, for people with diabetes, this regulation is impaired. In type 1 diabetes, the pancreas produces little to no insulin, so insulin therapy is required. In type 2 diabetes, the body's cells become resistant to insulin, and more of the hormone is needed to control blood sugar levels. During exercise, muscles require more energy, which glucose can provide. The body responds by increasing glucose uptake by muscle cells, a process that insulin enhances. For people with diabetes, this increased glucose uptake can cause blood sugar levels to fluctuate, especially during intense exercise. The effects of strenuous exercise on blood sugar levels can vary depending on a number of factors, including the type and duration of exercise, a person's diabetes management regimen, and overall health. In general, strenuous exercise can cause both high and low blood sugar levels. Hypoglycemia during strenuous exercise. One of the most immediate problems for people with diabetes during strenuous exercise is hypoglycemia. Hypoglycemia occurs when blood sugar levels drop too low, usually below 70 mg per deciliter. During strenuous exercise, the body uses glucose quickly, and if the blood and liver can't keep up, blood sugar levels can drop. Symptoms of hypoglycemia include dizziness, sweating, confusion, tremors, and even loss of consciousness in severe cases. For people with diabetes, especially those taking insulin or other glucose-lowering medications, the risk of exercise-induced hypoglycemia is significant. High blood sugar during strenuous exercise. On the other hand, strenuous exercise can also cause hyperglycemia or high blood sugar levels. This is because strenuous exercise triggers the release of stress hormones such as adrenaline and cortisol, which signal the liver to release more glucose into the blood. Especially for people with type 1 diabetes, hyperglycemia can occur if it's not managed properly. High blood sugar levels can cause symptoms such as thirst, frequent urination, and fatigue. Given the potential for both hypoglycemia and hyperglycemia, managing blood sugar levels during intense exercise requires careful planning and monitoring. Monitor blood sugar levels regularly before, during, and after exercise. Continuous glucose monitors are particularly useful for tracking blood sugar trends in real time, allowing individuals to make adjustments as needed. Before beginning an intense exercise session, it is important to check blood sugar levels. If blood sugar levels are too low, eating a small snack containing carbohydrates can help prevent hypoglycemia. If blood sugar levels are too high, exercise may need to be postponed until blood sugar levels are in a safer range. During exercise, frequent checks can help understand blood sugar trends and prevent sudden drops or spikes in blood sugar. Monitoring should continue after exercise, as blood sugar levels may continue to fluctuate for hours. Consuming carbohydrates before and during exercise can help maintain blood sugar levels, especially during prolonged or intense exercise. The type and amount of carbohydrates should be tailored to individual needs and the specifics of the exercise. Post-exercise nutrition is also important. After intense exercise, the body needs to replenish glycogen stores and repair muscle tissue. Consuming a combination of carbohydrates and protein soon after exercise can help restore and stabilize blood sugar levels. Staying hydrated during intense exercise is critical because dehydration can affect blood sugar levels. For people with diabetes, dehydration can cause blood sugar levels to rise because the concentration of glucose in the blood increases. Drinking water before, during, and after exercise can help stay hydrated and support overall blood sugar management. The above content only represents my personal views and is for reference only. Thank you so much for watching and listening.